to the following statement from the client need further teaching. You need further teaching. A nurse is providing teaching to a client prescribed allopurinol for gout. So you have two things, allopurinol for gout. Even if you don't know what allopurinol is, look at it. Gout. Gout, if you know things you need to avoid for gout, it's the same thing, right? The common one is to consume 2 to 3 liters of water a day. That will prevent crystal formation. So, which will further teaching, this is good. You don't need to intervene after consuming 2 to 3 liters of water a day. So that is good. It causes esophagitis. Therefore, you should take in the full glass of water. There's no need intervention. Because of esophagitis, you need to remain upright 30 minutes. You don't need intervention after taking the medication. The medication will stop my attack right away. No, it takes some time, 4 weeks before you can do the thing. You cannot use it in acute state also. So this needs intervention. It's a maintenance medication. I will use steroid cream for a small rash on my chest. You cannot put a steroid cream on a small rash on the chest. It's a sulfur drug, allopurinol. One of the biggest side effects of sulfur drug is Stephen-Johnson syndrome. Therefore, this also needs further intervention. So, full glass of water is good. Upright 30 minutes is good. Consuming 2 to 3 liters of water a day is good, but it does not take your symptoms right away. It's not for acute problem. And then steroid cream for small rash on the chest, that's bad. That's Stephen-Johnson. So 3 and 5 need further teaching. So number 1 is out. Same story, same strategy. Which of the following medication the nurse should question? Now you got to question it. The nurse is reviewing client medication after admission for CHF. Patient has CHF. What do you think? They assign a medication you can use, right? Digoxin to provide power. You don't need to question that, right? Azosarbide to prevent preload and afterload, right? It decreases blood flow to the heart. You don't need intervention. Furosemide is a furosemide to get rid of the fluid. You don't need any intervention. You don't need to question this. Tadalafil, this is a nitrate, right? It does its thing like nitrate. This is a Viagra. It does its own thing like Viagra. And you cannot take the feels with the pure nitrate as a sulfide. And therefore, we should question that. Losartan, this is an ARB. ACE inhibitor are used to remodel the heart after being in CHF for a long time. Therefore, losartan can be used in that situation. It's not a bad choice. So which one we should question is that of tadalafil. You're not supposed to be on it because you're on isosulfide. Severe hypotension can result. You can go into syncope. Number 3. You see how I'm answering the question, the same thing. Which of the following medication the nurse should anticipate? Now, I'm not questioning, I'm anticipating. That means I got to make a diagnosis, figure out what is wrong with the patient, and see if the treatment is appropriate. A nurse is obtaining the temperature of a 3-year-old client. The temperature was 101.9, and the client developed febrile seizure lasting 30 days. Which of the following the nurse should anticipate? If you have fever and you have seizure, what are you going to treat? The seizure or the fever? Whatever caused the seizure is what you treat. Since it was a fever, you give them Tylenol. You don't give them valproic acid, carbamazepine, or phenytoin. Since your brain is functioning the way, there's no disturbances in the brain chemicals. This is just too much fever causing the problem. So Tylenol to break the fever. At the same time, in acute fever or acute seizures, you don't need these anti-epileptics because they don't work. They take like sometimes 4 or 6 weeks to work. Therefore, all of them, it's not indicated. Anticipate number 4 for the right answer. Next question. So, number 4. And then she's teaching a new client about prescribed furosemide. So, he's on furosemide. Prescribe. What teaching do you provide? Okay. Which of the following statement indicate need for further teaching? That means you say something and the patient did not get it. They're saying the wrong thing. I'll change position from supine to upright slowly. Yeah, orthostatic from the furosemide. I will increase intake of banana because it decreases your potassium. So for using banana. So indicate further teaching. Indicate the need for further teaching. This does not. I would limit intake of sodium to less than 2 grams a day. This does not need further teaching. I will take cyclobenzaprine for muscle cramp. As soon as you see muscle cramps, this is hypokalemia. You should not take Flexeril to relax you. The muscle cramp is due to low potassium. Therefore, we got to fix the potassium. Which one need further teaching? Number 4, need further teaching. As you can see, it's our concept. Number 5, which of the following statement need intervention by the preceptor? What is the concept I'm trying to ask you? Preceptiness is observing a new graduate provide teaching to a client who needs 24-hour urine specimen. How do you collect 24-hour urine specimen? It's very key that you're supposed to know. Okay, you come up with the special equipment, special additive that you can add to the collection, but preservation, attempt to preserve the whatever you collect in the chemicals in it. The way you do it, you discard your first void. In the morning, wake up, and the first void you discard it. Then you collect for 24 hours, and the first void of the following morning. Okay, so both of them are all good. Refrigerate specimen during the collection. Yeah, keep them in the cold position. And collect the specimen in the sterile fashion. It's not supposed to be sterile. So this one need further teaching. Okay. Discarding the morning, first morning void is good. Discarding the morning after 24 hours. No, collecting the morning after 24 hours is good. Refrigerating the specimen is good, but collecting the specimen in the sterile fashion is wrong. So this one need intervention by the preceptor. So 4 is your right answer. Number 6, which of the following statement need intervention by the preceptor? The precepting nurse is observing a new graduate provide teaching to a client prescribed cane for left ankle fracture. When they give you the actual fracture, pay attention. Pay attention to what they're trying to show you. It's left ankle, so that's the affected. So this is the left, this is one that is affected. So which one need intervention by the preceptor? Advance the cane and the left leg. So the cane usually held on the right, the good side, and the bad side advance first. The cane should be in front and on the side of the right leg. That is the unaffected, not the affected. So this one need further teaching. This does not. The right leg move last because it's a good one. And the cane height at the greater to center. That's how you measure it. Therefore, this one, you hold the cane at the good leg on the side and in front, not on the bad leg. So this need intervention by the preceptor. Number 2. Which of the following teaching is appropriate? What teaching do you need? A nurse is caring for a client receiving chemotherapy with severe inflammation and ulceration of the mouth. Think about it. I get chemo, immunocompromised. I get severe inflammation, ulceration of the mouth. Which of the following teachings is appropriate? All I'm asking you is mucositis. They may not tell you the definition. They may describe it like that. Mucositis. How do you do it? Think about Kawasaki. The mouth is all red, ulceration. You don't want to eat. Yeah. Soft Bristol stool is good for you. Okay. You got to provide oral care meticulously so that it doesn't get dangerous and other stuff. Spicy food will make you burn, so don't use it. And avoid hot water. Extreme temperature. You should not wear your dentures after eating. The dentures are only for eating. Then after that, you take them out. So which of the following teachings is appropriate? 1, 2, 3, and 4. It's appropriate. Number 8. So what do we have? And next is assessing a client in the OB in the OB clinic. Client's last menstrual period was 8 weeks ago. Which of the following the nurse should document as what? Presumptive indicator of pregnancy. So there's 3 P's, I call them. The presumptive, you are presumptive. This is the subject. This subjective feeling. This is what the patient is telling. The probable, maybe, is the doctor, which is the objective value. And the positive, it means you're using a diagnostic test, some ultrasound, some CT scan to make a diagnosis. Therefore, collapsement. Patient is not telling you that you saw it, so it's probable, which is an objective value. Exercise, you examine the patient and you figure it out. That is a probable, it's an objective. Bluntment is the same thing. You also saw it, it's an objective value. That's not the patient telling you that. When you listen to the field art, you have diagnostic problem. So this is a positive. Excessive fatigue, well, the only way I can know if mother is telling me. So this is mother problem, and that is what? Presumptive. So that's the right answer. There's only one answer choice there, number 5. Okay, so just be careful. They can give you stuff. Only one answers are there. There's a reason why. They want to see if you're not guessing. 9. This is a classic favorite. 15-year-old presented to the school nurse with symptoms of acute asthma exacerbation. Which of the following is a priority? When you have asthma, you're getting dilated. Look for bronchodilator. But this is an acute asthma, right? Steroid is not the first line. Epinephrine is not the first line. Samaturon, that's long acting, not the first line. Albuterol, yeah. This should make the kid fix better. His heart rate may go up low, though, but you got to watch that. But albuterol is the treatment of choice for acute asthma exacerbation. And the last one. And then it's caring for a client with new leukemia diagnosis who need chemotherapy urgently. 30 minutes before the infusion, the client said, I want to go home now. It's the therapeutic communication. Answer the patient question. Don't bring your thoughts. Straightforward. If you can, then don't say anything. Let them talk. I will give you the AMA paper in a few minutes. Yeah, they have it right, but that's not therapeutic. Don't be afraid and we will take care of you. How do you know? Please tell me more why you want to go home. This is patient talking. There is nothing at home to help your situation. You exaggerating. Therefore, the best answer is number 3. This is an adapting class. That is the way you do this question. You got to master how to answer questions by using concepts to do that. And this is one of them. Take care of yourself. Have a good day. Bye-bye. Subscribe if you haven't subscribed. Thank you.